Hello, you're watching Health Day Now. I'm Mabel Jong. Doctors and parents are warning about an alarming increase in an inflammatory syndrome linked to COVID-19 cases in children. It's called multisystem inflammatory syndrome in children, or MIS-C. And according to the CDC, it's been diagnosed in more than 2,600 children in 48 states and resulted in the deaths of at least 33. At this time, MIS-C is still rare, but on the rise and can be very frightening. When COVID spread through the Padla family in January, the youngest son, 4-year-old James, seemed to have the mildest case. But a month later, James became very sick. He had developed a high fever, which crept up to 103. He had rash on his hands and feet, bloodshot eyes, and extreme stomach pains. He couldn't walk or even stand. He was checked into a hospital where he stayed for 10 days. Brian Padla is James's dad, and he joins us now from Philadelphia. And also here, Dr. Beth Son of Boston Children's Hospital, who is involved in MIS-C research. Thank you to you both. It's so great to see you.
Thank you for having us.
Good morning.
Now, Brian, after James became sick the second time, was he treated for COVID? And had you ever heard of MIS-C?
No, we actually, because we had all, my wife and I and my daughter all tested positive. When James showed symptoms of COVID, we just never had him tested. But then we all recovered, and a month, almost to the day, a month later, he started to get really, really sick. He just went from this like rambunctious kid to an infant, like in the matter of like 2 days. And, you know, the pediatrician just thought it was a fever and it would pass. But we knew that there was something more to it. So we took him to Children's Hospital of Philadelphia, where almost immediately they recognized the signs and told us about MIS-C, which we have never heard of before.
He was spiking fevers of up to 105 at one point. What were you told by your physicians was happening to James?
That it was just some kind of like, just some kind of illness that it would pass in like a matter of a couple days, just to try to push fluids in him. But, he was not really drinking much. He wasn't going to the bathroom. And then when the other symptoms like the rash and the eyes and all that started to appear, we just knew that, there was something, and we couldn't just do nothing.
And when he was in the hospital after not responding to earlier treatments, what finally worked to turn him around?
It's a drug. It's called anakinra. It's used to treat rheumatoid arthritis in patients. But unfortunately, that requires daily injections. So they did kind of hold off on that treatment after the other one wasn't working, because it's like a long-term commitment. So that's, once they gave him those treatments of the anakinra, within, I would say, 1 day, he was like almost 80% better. And then he just kept getting better and better and better.
Okay. Now, Dr. Beth Son is a rheumatologist at Boston Children's Hospital. Since the first case of MIS-C was diagnosed last spring, doctors now know that it is post-viral, that it happens after a COVID infection. Dr. Son, why is this on the rise? And are we seeing more serious cases? And what is going on in the child's body to cause the symptoms to show up after the child has seemingly recovered from COVID?
Right, so you're exactly right. This is not part of the acute infection, exactly as Brian described with his own son. It usually occurs about a month after the acute infection, and it's caused by a response in the immune system. And this also goes back to Brian's story that what really helped his son was actually medication for rheumatoid arthritis, which is also a disease that involves the immune system. And so it usually occurs about a month later, somewhere between 3 to 6 weeks. And because of the timing of that, it has been hypothesized that the MIS-C itself can be caused by problems with antibodies. But this is not clear yet. There's still a lot of research that has to be done to really fully elucidate what's causing MIS-C. In terms of the cases themselves, cases of MIS-C are linked to rising cases of SARS-CoV-2 transmission and COVID-19 infections in the community. So if you have rising cases of COVID-19, it's the expectation that about a month later, there'll be an increase in the MIS-C cases. And this is exactly what we saw in January and February, is that a month after the December holidays with increased travel and gatherings that we saw more cases of MIS-C. And this will continue to happen if there's ongoing transmission of SARS-CoV-2 with COVID-19 cases.
Okay, it seems to be showing up in a younger age group, aged 1 to 14. Do you have an idea of why some children might be more susceptible to this than others?
So that's an excellent question that a lot of people are working on. It does seem that the highest risk age group is 6 to 12, but it does span the pediatric age spectrum. We've all seen kids that are quite young and then all the way up to the age of 21, which is part of the official definition by the CDC of MIS-C, that you need to be just under 21 to be qualified for the diagnosis.
Okay, and any idea if it does seem that kids generally recover, but might others need continuing treatment at home?
So in general, part of the definition of MIS-C is that kids need to be hospitalized, which gives you a sense of the degree of illness that these children have. And some of the kids are on the floor, and some of the kids actually do need ICU level of care. And that's usually because their blood pressures are low. And I don't know if that is part of what Brian's son had as well. But we do see kids with low blood pressures, and that's because they either come in with a shock-like picture or the squeeze of their heart is low. So the function of their heart is depressed. And because of that, they can have low blood pressures. And that can be a fairly urgent problem that really has to be addressed with a lot of support and sometimes medications. The heart really seems to be very involved with MIS-C. And so it's not just low function of the heart or low squeeze. It also involves the coronary arteries, which are the vessels that feed the heart. And those vessels can become dilated and have little outpouchings called aneurysms. And because of that, kids need echocardiograms pretty frequently, which are just ultrasounds of the heart. And I imagine Brian's son has had several at this point.
Yeah. Brian, does that sound correct? Is that what James is going through right now?
Yes, his coronary artery is still inflamed. He goes back in another couple of weeks for another echo, but he is on like a daily chewable aspirin regimen for that.
Well, after 10 long days, James was finally released from the hospital. How is he doing generally now?
Now he's doing a lot better. It's been over a month since he's been released. We actually got the news. His levels were good, and he actually is able to stop the injections. He still has to take the aspirin for his coronary artery, but he is making like a full recovery. He's getting back to that, that rambunctious kid.
Right. Great.
Yeah.
Great. Well, that's good to hear. Dr. Son, what should parents be on alert for if their children have been exposed to COVID?
Right. So just the symptoms actually that Brian outlined so nicely. So really high fevers are like a heralding characteristic of MIS-C. So high fevers, you can see rash and red eyes, which is reminiscent of something called Kawasaki's disease, which might be related to MIS-C. It's unclear. And then the gastrointestinal symptoms tend to be quite prominent. So really, really bad abdominal pain, vomiting, diarrhea. Some kids have fairly prominent neurologic involvement. So they can have headaches, they can have neck pain. Sometimes they complain of blurry vision. And there are also respiratory symptoms. It's just much less common to have things like cough or cold symptoms as compared to acute COVID, where that's a really prominent symptom when you have that. So all of the things that Brian described are reasons, like that's the constellation of symptoms that we see. And those are the things that parents can be looking out for. And just as he did, bring the child either to the pediatrician's office or to the ER. And a lot of this hinges on how the child looks. So parents know their children best. And if your child does not look well and is not acting like himself, that's really a reason to bring them in if they have this other constellation of symptoms.
Okay. And what about your work into looking at the long-term effects, the concerns of long-term cardiac issues?
Right. So far, so this is being studied actively, which is hopefully some comfort to families who have been through MIS-C with their own children. So just as Brian is doing with his son, cardiology follow-up is really important. And this entails both laboratory studies and further echocardiograms, those ultrasounds of the heart, and then sometimes cardiac MRI. And so that's being followed very closely in federally funded studies. So there's that group that we have to look out for. But there's also, just as it's been described in the adult population of this long COVID or the long haulers, this is now being looked at in children as well. And those kids may not have ever had MIS-C or a bad acute COVID infection, just to be clear. So some kids develop symptoms of long COVID, and what they had was like a mild respiratory infection, but they never required hospitalization like James did for MIS-C. So there seems to be several different ways that this might manifest, and it's all being followed and studied so that we can hopefully get some answers for families.
Well, early last year, when the world became aware of the novel coronavirus, many people took a small measure of comfort in believing that children infected with the disease were at lower risk. Is your view changed by the growing number of MIS-C cases?
Right. So I do think that was really unnerving last spring. We had hoped that the pediatric population would be relatively spared, and then MIS-C sort of reared its head. And it's been an ongoing, really closely watched issue since. I do want to emphasize, though, that although when it happens, it's very scary for individual families, it is still rare. It is somewhat hard to estimate how rare because we don't exactly know how many cases are out there for those kids who don't come into the hospital, but it is fairly rare. There are studies being done to figure out which kids are at risk so that hopefully maybe you could know if your child's at higher risk for developing MIS-C after having had COVID-19. But it is rare. And the other good news is that there's been progress made on how to treat MIS-C. So when it first came in, it wasn't at all clear. It was presumed to be post-infectious, and so medicines for the immune system have been given since early on. So things like IVIG and also steroids. And then also, biologics like the anakinra that Brian mentioned for his own son. That biologic plus a few others have been used. And there are some recent small but informative studies about the use of IVIG and steroids early on in the illness of MIS-C, and that it really seems to help both the symptoms, but more importantly, seems to help the cardiac manifestations as well. So I do think, thankfully, we are in a little bit of a different place now with MIS-C in regards to diagnosis and treatment than we were last May and April when it came up.
Now, back to you, Brian. You initially described your 4-year-old little guy as rambunctious, and he's getting back to his old self. But how about your family? I mean, that sounded like a very, very scary situation to be in. It was probably very nerve-wracking for everyone.
I mean, to see your child, not be able to stand, and just barely lift up his head. It was absolutely terrifying. And, he still, even afterwards, still has some kind of anger outbursts. Doctors had said, it's probably, all related to his stay in the hospital. And, but I mean, he is getting better with that, as well as, as time goes on. But I mean, my other kids, we were all scared to death, really.
Yeah.
It was terrible.
Yeah. Well, Brian Padla, thank you so much for sharing your family's experience. Our very best to you all, and especially to James. Thank you. And Dr. Mary Beth Son of Boston Children's Hospital, thank you. Thank you so much.
Thank you so much for having me.
And thank you for watching Health Day Now. I'm Mabel Jong.